Okay, so it says here the LHI that our group chose to focus on was the reducing suicide rates in Summit County. We just like it's reducing the suicide rates was the leading health indicator, and we just mainly focused on the Summit County area for our presentation. A couple of the topics that we're going to cover for our introduction, we have like explaining our leading health indicator, explaining our infographic, the chosen policy. We'll cover the chosen policy, describing our persons of influences, the person that we intended to send our advocacy letter to and why, and then the description of what we learned and the relevance to healthcare that it has led us to.
So the overview of our leading health indicator, specifically for Summit County, the suicide rate per 100,000 in Summit County was 18 in 2015. So that is much higher than the national and the state average, which was 13.3 per 100,000 and 19 or 13.9 per 100,000. So yeah, that shows it's much higher than the national and the state average. Looking into that more, the poverty level in Summit County was 14.8%, which I think that has a huge correlation to do with the possible suicide rates. And that 14.8% is the same as the state average poverty level. Other than that, next. Oh, you gotta unmute yourself, Naomi.
Okay, is that better? Okay, so here's our infographic, the reducing the suicide rates in Summit County that we did. Through identification, action, and knowing where to go for help, our infographic hopes to reduce suicide rates in Summit County, Ohio. Summit County, Ohio has a higher suicide rate per 100,000 than US and Ohio average in 2015. United States, in the first graph here, it's going to show 13.3. In Ohio, it's 13.9. And in Summit County, Ohio, it's 18. Identification includes warning signs to look for. They include talking about wanting to die or want to kill itself, increasing the use of alcohol or drugs, displaying extreme mood swings, withdrawing or feeling isolated, looking for a way to kill oneself, such as searching online or buying a gun, talking about feeling trapped or in unbearable pain. A couple of the action plans, there's 5 steps for helping someone in emotional pain. Ask, are you thinking about killing yourself? Keep them safe. Reduce access to lethal items or places. Be there. Listen carefully and acknowledge their feelings. Help them connect. Save the National Suicide Prevention Lifeline number. And it's listed below, but it is also 1-800-273-8255. And stay connected. Follow up and stay in touch after the crisis. We also have an action that we call 911. Explain to the dispatcher that you or someone you are with is thinking of hurting themselves. Tell the dispatcher that there is any firearms or other weapons available. Ask if the dispatcher can send a CIT, which is a crisis intervention officer, as well as the paramedics. CIT officers are specifically trained police officers in dealing with people in crisis. Paramedics assess these patients and transport to the hospital if necessary. Stay with the person until help arrives. Keep them calm and help explain to officers and paramedics what's going on. Another graph we have down here at the bottom, it's where to go for help. There's a couple different things listed, National Suicide Prevention Lifeline, Text Home, a support hotline for Portage Path Behavioral Services, Summit County Suicide Prevention, and then the survivors of Summit County. And all those numbers are listed down there in that graph. We also have places that you can go for help. Our Summit County emergency rooms. We have Cleveland Clinic, Akron General Emergency Room, Summa Health System, Akron Campus, Barberton Citizens Hospital, Summit, or Summa Health System, and Western Reserve in Cuyahoga Falls, as well as the Akron Children's Hospital.
Okay, so our chosen policy was the Suicide Prevention Act, HR 5619, and it was sponsored by Representative Chris Stewart. It was introduced in the House on January 15th of this year. It authorizes funding in grant programs. So the Centers for Disease Control and Prevention will award grants to state, local, and tribal health departments to expand surveillance of self-harm. Also, the Substance Abuse and Mental Health Services Administration will award grants to hospital emergency departments for programs to prevent suicide attempts among patients after discharge. This bill also initiates data sharing by grantees, and it would execute data by sharing among surveillance programs that collect data on suicides and self-harm. It also implements geographic distribution in communities with a shortage of prevention and treatment services. It integrates all levels of governance, including the federal, state, and local levels, which allows for a less expensive, more efficient, multi-system approach to help reduce likelihood of self-harm and suicide. Some consequences: the good definitely outweighs the bad. So some of the good is that it establishes grant programs to prevent suicide and self-harm. It integrates multiple systems, including local, state, and federal levels, to combat suicide rates. And one of the negative effects is it potentially may not impact all individuals who are intending to harm themselves. So this is why we think it would be important to make sure this bill applies to organizations such as crisis centers in Summit County. Next.
The person that think is the person that influences Amelia Strong Sykes. She is the Akron House of Representative. She's the Democratic leader and has been serving since 2014. She pushes for job training, which is perfect for this bill, HR 5619, because it'll provide funding to the hospitals and healthcare systems to promote suicide awareness and help get that to the hospital workers. We support the bill 100% because it'll hopefully reduce the suicide rates in our community and around the country. Next.
So in conclusion, this legislation has the potential to affect the leading health indicator. So the goal here was to look at all of this and decide how can we actually change. So we recognized the problem would be reducing the suicide rate, and we can do this with our House bill that's going to pass, or hopefully going to pass. And this will give grants that will prevent the self-harm and suicide. So healthcare systems as a whole look to deliver these services that are relevant to the requirements of a population. Since we focused on Summit County, the requirements of Summit County are to reduce those self-harm and suicide rates because, as Trevor said, in comparison to the state and to other larger components, the Summit County rates are very high. So in this case, the leading health indicator defines that a requirement as necessary for mental health status improvement. So the needs of the population we focused are the self-harm and suicide. So the LHI is going to need more assistance than just this one piece of legislation, but this is a huge start towards reducing the self-harm and suicide. Healthcare systems as a whole need to focus on this, and we've learned a lot of things through the semester, such as the different things required to actually affect this. So the grants that comes from the finances that we've learned. The lobbying went into getting the legislation started to begin with, and then finding all these resources that are actually going to affect parts of this. So as we recognize the certain places in Summit County, such as the different hospitals, the crisis centers, these are the places we need to focus on. So tying it all together, we have our leading health indicator that we've recognized. We have our legislature that, if passed, will help implement all these resources required. So this is, in totality, what we need to provide change. And I think that's all we have.